All right, guys. So today I have the pleasure of interviewing Dr. Jessica Drummond. She is a phenomenal individual. She is a powerhouse in the field of physical therapy and nutrition and women's health and beyond. She's just amazing, and her mind is just a captivating place to be. So, and so I wanted to bring her on because you guys know I talk a lot about you are what you eat, and I talk a lot about nutrition, and I see a lot of pregnant and postpartum women and just general patients with pelvic health conditions. But a lot of people don't realize the impact that nutrition can have on all these things, especially moms coming off the heels of pregnancy and just trying to nourish their bodies and deal with the baby and sleep and all this other stuff. So I thought, who better to bring on to share their knowledge than Dr. Jessica Drummond. So floor is yours, my dear.
Thank you. Thanks so much for having me. It's always a pleasure to be with you. And yes, I mean, pregnancy postpartum is probably one of the best times for kind of reassessing our nourishment, our nutrition, for two main reasons. One, of course, what you're eating during pregnancy is going to directly help to kind of build the baby, if we're talking about just pure raw materials, but also your gut microbiome. So there's a whole huge population. We have so much more bacterial cells than we have human cells in our body, and genes, it's like even 100x more than that. So in fact, this is a really interesting stat. The human genome was mapped, I don't know, maybe 10 years ago now. It's been a while. And we thought this was going to be this, wonderful, amazing discovery. And it's super interesting for sure, but it's not extremely complex. The human genome is as complex as a Chardonnay grape.
Oh, hold on. But I was thinking I was a complex individual.
All right. Well, and you are. The reason that you're more complex than a Chardonnay grape is that we have this huge population of bacteria and other microbes that live primarily in our colon, although there are these sort of submicrobiota everywhere on the skin. There's a vulvovaginal microbiome, there's a uterine microbiome that's distinct from that, there's a placental microbiome, there's a penile microbiome, there's a lung microbiome. So what these microbiota are communities of bacteria and other microbes that support ultimately our entire health. But when we're talking about pregnancy to postpartum, your original kind of foundation of your immune system comes from the transfer of your mom's microbiome to yours during labor and delivery. And so that's why kids who are birthed vaginally and who are breastfed tend to have a more robust immune system, but that's only if their moms had a healthy microbiome, gut microbiome. And vulvovaginal microbiome as well. And so in pregnancy, what we really want to do is be creating the soil, let's say, or the environment where really healthy microbes can grow. And to super simplify this, healthy microbes love vegetables, fiber, water, healthy fats, things like olive oil, nuts and seeds, coconut oil. And, certainly proteins and amino acids are important because we've got to build muscle and connective tissue and things like that. And what bad, quote unquote, bad bacteria, the more pathogenic bacteria thrive on processed grains and sugar, basically. Mm-hmm. So if we're eating a food plan that's much more nutrient dense, full of fiber, full of vegetables, the standard WHO recommendation for vegetables is 8 to 10 per day. But the American goal is 5 a day, because we don't think we can hit the 8 to 10, not because we are just beings that need less vegetables, right? So it's important that we think about just adding nutrition rather than restricting our food plan, especially around pregnancy and postpartum. And postpartum is interesting because in postpartum, especially if you're nursing, you actually need more calories than you did pregnant, So it's not a time to really be immediately thinking about getting back in your skinny jeans. It's, again, making sure that you're getting a robust food plan full of nutrients and hydration and all the building blocks. You know, we need a lot of fat postpartum because we're still building that baby's brain. It's very immature when it comes out.
Yeah, and I think that's a very good fact for people to hear, because nowadays with all the stuff on the media and everywhere, it's, I need my baby body back now. I need to look like this. I need a, you know, and there's all these things swirling around, and women are just so caught up with, oh my gosh, if I don't get back to looking like I did 9 months ago, I'm a complete failure. No, you're a mom. You just need to mom, and you need to enjoy this time and be present where you are and enjoy that and continue to grow you and your baby, because your body's gone through changes and it's healing, and nutrition is going to be super important for that healing process too.
Absolutely. And, you know, my patients who have things like prolapse or pelvic floor dysfunction, or like have a tear or an episiotomy during delivery, if they have been eating this kind of nutrient dense, you know, lots of good quality protein, maybe some collagen support, which can be either like collagen protein powder or just well digested animal protein. The challenge is that a lot of us, you know, you can get everything you need from food, assuming that your digestive system is absorbing nutrients well. Yeah. And for some women, that's hard. If you're under a lot of stress, if you've had a lot of pain, if you're just super fatigued, if you have low stomach acid, low digestive enzymes, there are a number of factors that make it hard to digest even the perfect, you know, quote unquote, perfect diet. So that's where things like protein powders, especially in postpartum, or like blended soups, like someone making you just a homemade vegetable or, you know, chicken and vegetable soup, something like that, can be very nourishing because it's easier to digest than, you know, eating a steak. Like eating a steak takes a lot of chewing and takes a lot of stomach acid and takes a lot of digestive enzymes, which is great if you have all of those things robustly, but if not, you may need a little bit of support.
And now you mentioned fatigue can also play, and stress can play a huge role on healing and recovery. Most moms don't sleep, especially those first several weeks. So why is sleep so important? One, and then two, what things can they be looking at, lifestyle changes, little things that they can implement on a day-to-day basis to start to progressively improve sleep habits, sleep health, and general overall well-being?
Yeah, I think, well, sleep is essential for recovery because it's, you know, first of all, it's like one of the rare times, and even when you're postpartum, your vigilance center in your brain is not even totally off when you're asleep, right? Because you can still sort of hear the baby and, you know, you're still somewhat on, but that sleep is really important for recovery because it's the time when you're just actively resting and there are repair mechanisms going on. Brain autophagy, which is essentially like your brain is literally kind of a self-cleaning oven, but only if you're asleep. And so there are times that we need to restore and recover. Now, immediately postpartum up until, I don't know, 2 years, it's not super uncommon for kids to wake up during the night, to have irregular sleep patterns. They might sleep through the night for a while, then they get up. You know, moms start to develop bad habits. So one of the first things you can do is just really prioritize a downtime. So at night, don't get on Facebook in the middle of the night. Like anytime you turn on a blue light from your phone or your laptop in the middle of the night, you're changing your sleep hormones and makes it harder to get back to sleep. You're actually suppressing melatonin. Second, one of the most valuable things you can do, in my opinion, and I did this with my second daughter after learning, my first daughter didn't sleep till she was like 6. So I was
I was bad. Mine didn't sleep till 2.
Yeah, it was horrible. I mean, I was just like, literally, I applied for a job at a hospital because it had 6 a.m. to 6 p.m. daycare. She was probably like 3 years old. I was so exhausted at this point. And I was like, because she sometimes would wake up at 3 a.m. for the day. And so I brought her to the daycare. I didn't even take the job. I just signed up for the daycare so I could take her when she would get up at 3 in the morning. I'd take her at 6, drop her off, and go home and go back to bed.
Oh gosh.
So I did that for like 8 months just to try to like save my sanity. But the truth is that sleep deprivation, I mean, there's a reason they use sleep deprivation as torture, right? So when my second baby came along, first of all, I did things that were a little different that I think made a big difference. One, my own blood sugar was a lot more stable. I didn't know at all what I knew the second time about nutrition with my first daughter. So I really didn't eat sugar at all for probably 2 years around the time that I was pregnant and breastfeeding my second daughter. So both of us had a lot more stable blood sugar, and that is key for sleeping through the night. So my younger daughter was a much better sleeper from the get-go. But also I hired a postpartum doula. I didn't pay for tons of supplements. I didn't do a lot of really like unnecessary things postpartum, but I hired a postpartum doula / night nanny for like maybe 2 weeks. Now, the reason I did it with her was that she had some NICU breathing issues and I couldn't stay up and like physically watch her 24 hours a day. But looking back, that was the most valuable thing that I did for my health, because it allowed me to really sleep for the first 2 weeks postpartum to get recovery. So now the night nurse would bring her to me whenever she needed to eat, but that's totally different than being kind of like always on when you know that there's someone in charge. So if your partner can be home for 2 weeks on paternity leave, or you're a family member, or like I said, don't eat out, don't like save your money and hire a night nurse for 2 weeks. It's really worth it. A month if you can afford to do that. And then there are people now that I didn't know about at the time with my oldest daughter, but there are actually people that help you to kind of sleep train your baby. And my sister adopted her oldest son, and she adopted him at maybe 6 months, and he had some health problems, and he wasn't living in a very stable situation with his birth parents. She hired a woman to help literally sleep train him. Now, you can't do this immediately postpartum. It takes, the baby has to be like 6 to 8 months old. That kid, to this day, he's 9 years old and he sleeps great. Like, it took her like 3 days to get him sleeping perfectly. And this kid was sleeping terribly. He had never been in a bed. He was living in this horrible situation. And 9 years later, that still holds. So I recommend those 2 things. But I think from a nutrition standpoint, it's basically 2 things. It's blood sugar stability. It's eliminating the blue light exposure after it gets dark. And then, or if it's dark at 3 o'clock where you live in the winter, then say 8 o'clock, something like that. And just really prioritizing the fact that just like we don't need to jump right back into our skinny jeans, there's a period of time where recovery is required. My first boss at Women's Hospital used to say, and I think this is so important, a C-section is the only surgery where we give someone no rehab, no recovery, and we send them home with an infant. Right? And it's just as hard and just as physically challenging if you've had a vaginal delivery. So I think it's really important that we begin to recognize that and give ourselves the grace that it takes to recover. And that includes support, that includes sleep, that includes hydration. And it's okay to kind of check out of work and social media and too much connection, that time if you feel like it.
Now, what about, there's some research that says for a lot of women, and what I've found, especially with my older pelvic health populations, everybody's got a thyroid issue, just about. And so the research says usually immediately postpartum, there are fluctuations in your thyroid hormone. So ultimately, what might appear as baby blues may not even necessarily be that. It may just be as a result of low thyroid hormones, which usually will regulate after, I think they said up to 6 months. But the problem then is they may overregulate, and now you end up in a state of, too high a level. And so could you speak to that for a little bit, especially for a lot, because that's not even something that's commonly tested for. It's not tested at the postpartum visit at 6 weeks, and a lot of the times if you've got a physician who is not holistic, he's they practice holistically, then the first thing they're going to recommend is antidepressants or, you know, these other things, which aren't necessarily what you need at that time.
Yeah, so postpartum thyroiditis, and actually the triggering of almost any autoimmune condition, is much more common postpartum. So the research that I've done is actually in vulvodynia, which I do believe has an autoimmune component, and it tends to quiet during pregnancy because of the immune shifts that kind of quiet down the overreaction of the immune system so that there's not rejection of the fetus. And then, but pretty immediately postpartum, there is that immune shift that can trigger autoimmune disease. So postpartum is a very common time to trigger what's called postpartum thyroiditis, but also Hashimoto's. So anything that, and that could be either low thyroid. Hashimoto's is always low thyroid, but could also be hyperthyroid. So one thing that does prevent that is to take 200 micrograms of selenium starting preconception and all through pregnancy. In any really good quality prenatal vitamin, you will find that. I think the one that I've been recommending most recently, because of some of the other factors, it's by Seeking Health, and they have a prenatal vitamin called Optimal Prenatal. So double check that, but 200 micrograms a day of selenium is key. And that can help prevent postpartum thyroiditis. Also, keeping your blood sugar stable can help support thyroid health, because if cortisol regulation is off, like if the cortisol is our stress buffering hormone and it has a daily rhythm to it, and if either the rhythm or the actual levels of cortisol are off, especially if they're high, which tends to happen when a person is under prolonged stress, then the cortisol can actually interfere with different conversions of thyroid hormone at different points in the biochemical reactions. So you have to get blood sugar right first. Like all of the rest of the hormones, stress buffering hormones, thyroid hormones, and sex hormones like estrogen, progesterone, testosterone are dependent on having healthy insulin and blood sugar levels, more from food and lifestyle than from cortisol. Because if we start having to use our hormones to regulate those, then everything else gets a little bit thrown out of whack. And then, if you're feeling symptoms of, like, if you have postpartum depression, or you're having hair loss or cold hands and feet, or weight gain or weight loss, have your doctor check. The TSH level is the typical blood test that they'll use to screen for thyroid dysfunction, but it doesn't usually tell the whole story. So if you feel like you have those symptoms and your TSH level is normal, ask for a little bit of a more comprehensive panel. So you also want to test T4, T3, reverse T3, and the thyroid antibodies, because that will show you if there's an autoimmune thyroid condition.
Awesome. And just piggybacking off of that, with a lot of fertility cases too, a lot of women are given metformin as well sometimes. And is that along the same lines, just to help with regulation of insulin in hopes of then therefore regulating the sex hormones?
Sort of, but also because PCOS, which is a metabolic, it's sort of on that spectrum of diabetes, pre-diabetes, is one of the most common causes for infertility. So I prefer to optimize PCOS by, again, using nutrition. There are some really good supplements that support blood sugar stability, and exercise too. And in some cases, women are actually over exercising. So it's a matter of regulating the exercise to kind of keep blood sugar balanced, but without over stressing the system. So sometimes it's more about timing and consistency than level of intensity. And there is a way to, from a lifestyle perspective, really optimize your basically metabolic health so that PCOS or something similar to that isn't going to impact your fertility. And the sooner we can do that, the better. And what happens is, unfortunately, is that women, when teenage girls and young women present with early signs of PCOS, usually what happens is they're just put on the birth control pill, which masks that. And then we didn't ever get the chance to heal it while the menstrual cycle was maturing. Now we can still intervene, but the quicker we can get these women off birth control pills and get them to a lifestyle that reverses PCOS, I find clinically that's one of the easiest things to do. It's just a matter of implementation.
Mm-hmm. That's awesome. Guys, I hope you're hearing this information. It is a lot, and I'm pretty sure that most of you are saying, oh my God, I did not know that. My mind is blown. As far as, again, with postpartum health, I know you mentioned shakes a lot and blended soups and whatnot. I was a big fan of smoothies just because I never had time to cook, especially with my youngest, because my kids are 2 years apart. So I had a newborn and a recently turned 2-year-old, and there was only so much time in the day. So with that, are there any favorite recommendations for, blended beverages that you have that, or things, fruits, vegetables? I love spinach, so I threw spinach in everything, spinach and blueberries. But are there any things that you strongly recommend to really help with nutrients and so on, in addition to supplements as well?
So for foods, I like to put an avocado in the smoothie or coconut milk. We want something with a good quality fat because postpartum women need fat for their own brains and their baby's brains. Also any nutrients. So berries are a great fruit to add because they're low glycemic and they're very high in antioxidants. Any kind of berries. You can use kind of greenish bananas, maybe a half a banana, to just give it that smooth taste, which is totally fine. Too much banana or tropical fruits like mango or pineapple are a little bit high in sugar, but they don't have to be completely eliminated, just reduced. And if they're more greenish, like the bananas, you can't really have a greenish pineapple, but greenish bananas are less glycemic than the more ripe ones. Yeah, throwing in some leafy greens is always good, or doing a more savory smoothie. Like the other day, the flu has been rampant around here. So to keep it from our house, I've been feeding my kids like garlic, and you can do this in post-pregnancy, postpartum, when you can't really take a lot of medication, a clove of garlic, a knob of ginger, a savory smoothie with things like cabbage or leafy greens, avocado, celery, broccoli stalks. You can make like a smoothie or a juice out of greens and avocados and a little bit of flavor. I usually put lemon. I have a high-speed blender, so you can just peel a lemon and put the whole thing in it, with a knob of ginger and a little clove of garlic. And that is very antiviral, antibacterial, and it's really tastes good, if you kind of shift to that more savory. But the kind of day-to-day smoothie that I would do in postpartum would be probably like a half cup of berries, half an avocado, some leafy greens to add some nutrients and fiber, a little bit of banana if you want more creaminess, almond milk, hemp milk, or coconut milk. And then there are 2 protein powders I like in particular postpartum. There's a new company called Umaxa that is a very clean protein. It also has a little bit of chia seeds, which for most women, that can be really helpful. It's a little bit hormone balancing. If you find that you're getting like tons of breast tenderness, it can be a little excessive estrogenic, that you can find that with flax seeds too. Flax seeds and chia seeds are great for fiber. They're great for hormone balancing, but for some women, they do tip it a little far. So be careful if suddenly you're like, gosh, my breasts are always tender, like my periods are lengthening, but you've been eating like 3 tablespoons of flax seeds a day, then pay attention.
They're also good for to alleviate constipation, because that's the problem that a lot of women will have. And I always recommend chia pudding. Just making some chia pudding and throwing it in the refrigerator, and then just eating one of those a day just to help with bowel movements.
Absolutely. So you do have to be mindful of flax seeds and chia seeds, but when you can add them at a moderate amount, that can be really beneficial for bowel health. So I like that protein. It's plant-based. You can also throw a little turmeric in, which is very anti-inflammatory, or cinnamon, which is blood sugar balancing. So just like a teaspoon of cinnamon, right, in that smoothie is tasty. So I like that one for postpartum recovery. It's also good for amino acids for rebuilding. And I also like the Seeking Health also makes a prenatal protein. It's basically a protein powder with their prenatal vitamin in it. So you wouldn't take both. You wouldn't take both the prenatal vitamin and the protein powder, but some women can't really tolerate those prenatal vitamins because it kind of makes them nauseous. So having it mixed into the smoothie If you're going to continue to take your prenatal vitamin a couple months postpartum, that can be valuable. So those are a couple of specific proteins that I use in that population.
That's awesome. And what are your recommendations for probiotics?
For probiotics in pregnancy, you want a pretty simple formula that's a combination of lactobacillus and bifidobacterium, because those two kinds of strains are the only ones that have been tested and cleared as safe in pregnancy. So that's generally what I use in pregnancy for probiotics. But more important is actually prebiotics, which is basically fiber and probiotic foods. So a little bit of sauerkraut, fermented beets, kimchi, things like that. Just starting to eat some fermented foods is about 5 to 10% of your daily intake.
Awesome. And any particular supplements outside of those? You mentioned the selenium, you mentioned the protein powder, but any particular supplements outside of those for postpartum to help moms with recovery and healing and just, you know, getting their nutrition in?
First would be fish oil. So I do like fish oil supplements. It's very anti-inflammatory and it adds that healthy fat, because especially in pregnancy, it's not always recommended to eat a lot of fish because unfortunately most of our waters are polluted with heavy metals. So we can eat some fish in pregnancy, but not as much as you really want to get the omega-3s. So that would be one, fish oil. And honestly, you know, if you're eating a diverse food plan that is being well absorbed, it's going to be more fun to just get it in food. And, you know, and for the first few months to potentially continue to take your prenatal vitamin if you find that you just have trouble getting enough food in, that you need that little kind of extra micronutrients.
That's awesome. Well, thank you so much for this. I think this is very beneficial because I know in recent times, I've had a lot of moms asking a lot of different questions, especially about probiotics. But just in general, I think it's good for people to hear how valuable nutrition is, not just necessarily at, you know, one particular point, not during pregnancy or postpartum, but just in general. And as we go through different stages, our needs are going to change. You know, what our body needs to support it may change. And, you know, just being aware of that, because some people just, they don't know, and they've never been introduced to it. So I think that this information will be very helpful to a lot of people.
I'm so glad. And I think that's a really important point, that nutrition evolves over time. There's no one perfect diet. It depends more on the person than the issue. So don't be swayed by, you know, whatever the latest dietary trends are. Go back to basics, hydrate, eat lots of vegetables, chew, eat in a relaxed situation, get some protein in, get some fat in. Don't overthink it, because a lot of times just transitioning from eating a lot of processed and, you know, restaurant foods, fast foods, that kind of thing, to just home cooked, nutrient dense food makes a really significant difference. And I don't want people to not do that because they're too overwhelmed by what they should eat.
Yeah.
So. Yeah.
That's awesome. Well, thank you so much. And if people need to get in contact with you because they want to learn more or they have more questions, how will they do that?
So our website is integrativewomenshealthinstitute.com, and that's where everything lives.
Where all the magic happens.
Yeah, where the magic happens. And if you want to just follow kind of the day-to-day updates, we're on Instagram at Integrative Women's Health.
Awesome. Well, thank you so much again. And I will be putting all that information for you guys when this is posted, so you guys have access to that, and you can contact either myself or Miss Jessica with any questions that you have. Feel free to ask. She is truly a wealth of knowledge. Trust me, you will want to pick her brain. All right, Miss Jessica, thank you so much.
Thanks so much for having me. Great to see you.
Likewise.
Bye.